Good afternoon. My name is Faith Kirudi. I'm a nurse and specialized on reproductive health and HIV for adolescents and young people. I have been working for the last 10 years with the young people, especially in the areas of reproductive health and HIV. And through my 10 years of work, I have been able to interact with different policymakers, implementers in Kenya and also in East Africa, where we've managed to develop the policies and guidelines that govern us in terms of provision of healthcare services for adolescents and young people. And out of this, we've seen tremendous improvement in terms of access to services around HIV and reproductive health for young people. And also, we've seen that there's change in terms of adherence to treatment, especially for adolescents living with HIV, which we've been able even to showcase some of the best practices in conferences and best sharing sessions within Kenya and also East Africa, and also being a part of the PATA network of frontline workers. We've been able also to do best sharing sessions with other health workers from different countries. And this has also helped me grow as a person, as an individual, and has helped me also improve in terms of programming for adolescents and young people. Frontline workers are very important people in the daily lives of every human being because they touch a life in one way or another in our healthcare systems, in our facilities, at the community level. They put a smile to many people who need their care and love. And sometimes health workers also just they're like anyone else. They are human. They are touched and they feel sad when they lose their clients, maybe something they do not expect. So as a health worker or a frontline worker, we have faced a few challenges here and there as we execute our duties. When I was growing up, I wanted to be a nurse, and I loved nursing because I admired the uniform for the nurses. When I completed my college and I went to work, I found life was different from what I was thinking. It needed me to really rethink and ask myself, is this what I really wanted? But deep within my heart, it was nursing that I wanted to do. Take care of the sick people, talk to them, put a smile on their face. And I did that. And through networking and learning from other people, I have been able to reach where I am today. Just like any other frontline worker, we face challenges. We have faced challenges in terms of service provision. Sometimes we do not have enough commodities. The infrastructure does not allow us to deliver services as we would expect. Sometimes we would ask for a better pay, but maybe the systems do not allow. Sometimes we would want to have a better cover or a medical cover for ourselves and our families, but maybe the systems don't allow. WHO states clearly that we should be able to provide and take care of our frontline workers by providing a safe environment for working, a comfortable environment for working, because I believe most of the time we spend in our working places. And that is the best place. We need a lot of peace and love so that we can be able to take care of the other of our clients. However, that may be not possible because of different challenges faced in different countries. Like now, when the COVID pandemic came around, most of the health workers, frontline workers, put their lives in front to serve the community. Some lost their lives, some lost their loved ones because they transmitted the virus as they were doing their daily work. So I speak on behalf of the many frontline workers that we request that we get support, a supportive system in terms of remuneration of the allowances the health workers get. In terms of infrastructure, we need systems that have when we need space to provide services, we can get that enough space. We also need safe spaces where we can meet and talk and share our experiences, best practices from different countries where nurses come and sit and talk. all the health workers come and sit and talk about their experiences. There are some countries that are advanced in terms of provision of healthcare services. They can share some of their ideas with the other countries, with the other frontline workers, and see what best practice we can borrow from each other. And I want to thank Pata personally for really thinking about the frontline workers. Let's see what change can we bring to the frontline workers. Thank you very much.
I would want to begin by saying that we have done a lot. The world has done a lot in terms of supporting the frontliners who are the service providers. And for me, I would not want to limit it to the health providers. I would want to expand to community-based organizations and young people engaged in the fight. And it is important from John's presentation, we see the value of resources, financial resources, but also the value of the health personnel. So the health personnel remains at the center of improving services or helping us fight against HIV and AIDS. And it would be good for us to first of all understand what some of those key challenges are. One of the key challenges which we find in our context is shortages of trained health personnel. So we see, especially in areas that are affected by conflict, armed conflict, for instance, in Cameroon, the Northwest region where I come from, you see that many communities have had to function without sufficient support because some of those facilities have been burned down and nurses are fleeing from conflict. And as a result, it affects the access to services for children and young people. And so my suggestion would be, as much as we are improving on training service providers, we should also put in place laws that protect service providers. Because if service providers don't feel protected, then they don't feel safe to provide services in their communities. One other challenge which we are seeing is limited infrastructure. So you have in some communities about 4 service providers sharing the same office space. And these are people who you expect to provide counseling services. I mean, how do you expect them to function in that context? It becomes very difficult. So there is need for us to also improve on the infrastructure, and that translates mostly to resources, to financial resources. And again, because of conflict and the pandemic, we see that service providers are working under a lot of pressure. And so to support them, to help them have access to mental health services would be a plus to improving the work that they are doing in the community. And by this, we are requesting that in program designs, there should be considerations in factoring mental health breaks for service providers. One other challenge which we have seen, especially in the context of the pandemic, that's the COVID-19 and probably the Ebola virus, is the fact that service providers have had very limited access to personal protective equipment. And you would hear service providers say, oh, I'm afraid to provide services because I'm going to be exposed. I don't have the resources that I need to protect myself. And so there is need, again, for resources to be available to protect service providers. And we don't just need to do this at the moment. We need to be intentional. We need to be proactive to ensure that systematically these resources are available and service providers should feel safe to provide services. And another thing which we need to pay attention to is the reward systems that we have in place. Many of our service providers feel that they are not getting rewarded based on the contributions they are making. And as a result, they'll tend to other countries where they feel that their hard work it's acknowledged. And so for us to keep service providers back in the continent, back in our countries, we need to put in place systems that make them feel valued, make them feel that their time is appreciated, their effort is acknowledged. And this is not just financial contributions. We are also looking at non-financial reward systems. They all contribute to motivating service providers remain in in provision of care to children and adolescents living with HIV. And lastly, I would say that if we only want to focus on what others need to do for the service providers, then we will not be fair to the discussions, will not be balanced. And so I think that also on our part as service providers, we have sometimes missed the focus. There are some service providers who are not available to work, who are nonchalant, who are negligent in their provision of care. And so we think that it will be important for systems to be put in place where service providers are held accountable. And most often this can be done when service providers themselves serve as advocates, but also are there to look at those who are not doing what they're expected to do. And there is a fair system to bring to book those who are not doing what they're expected to do. So I would say that that to me is a show of solidarity when we talk about showing solidarity to service providers, Rosemary.